A patient on lithium carbonate complains of nystagmus, visual hallucinations, and oliguria. What complication is most likely? After teaching deep breathing and coughing exercises to a patient who will undergo a surgery, the nurse asked the patient to demonstrate and then helped him in correcting. What part of therapeutic communication is used? A 11-year-old girl was brought to the emergency with respiratory arrest due to drowning. Cardiac resuscitation was done. What is the major complication that may happen if treated after drowning quickly? A nurse interviews a patient recently admitted to long-term care facility to obtain information on the patient health perception. The nurse encouraged the patient to elaborate this change. Which of the following type of question would be the most effective in this situation?
Which medication is safest to reduce febrile seizures in children? The nurse manager received complaints from some nursing staffs about improper work distribution and discrimination. How should the nurse manager handle the situation? Gastric suction can cause a patient was on a course of lithium carbonate drug. During the nurse found that he complained from nystagmus, visual hallucination, and oliguria. Which of the following drug-related complications best symptoms? Patient fall down in hospital. Where is the nurse documentation? A nurse in surgical unit is preparing for a wound dressing. She sneezed without a face mask on. Which of the following is the most appropriate action? Which of the following diagnostic tests is definitive for TB?
A psychiatric patient was prescribed sleep medication at 10 p.m. but was found asleep. What should the nurse do? Which of the following tests will be most beneficial to a nurse if there is an exacerbation of heart failure? During the assessment phase of a preoperative interview, the patient reports feeling nervous. The patient conveys to the nurse that a parent died in surgery due to malignant hyperthermia. To whom would this information be most important?
Doctor ordered ofloxacin. What is the correct route?
A charge nurse noted poor staffing schedule in one of the shift. The schedule may cause problems among staff members in the unit. The charge nurse should bring the problem to a nurse working in medical unit is preparing with droplet precautions in place. What is the correct sequence for putting the equipment on?
Which of the following is a complication of thyroidectomy?
The nurse is assigned to care for the patient with Cushing's syndrome with pH of 7.2. Which of the following condition should the nurse expect to patient?
Which of the following supplement decreases the risk of neural tube defects?
A nurse is giving discharge planning instructions to the parents of a 1-year-old child acute otitis media. Which of the following discharge instruction takes priority?
What is a characteristic of democratic leadership style? Ringer lactate consider as which type of IV solution?
The nurse assesses a client with ileostomy for possible development of which of the following acid-base imbalances? A nurse working in medical unit is going out with droplet precaution in place. What is the correct sequence for putting the equipment off?